Welcome back to Long COVID Doctor, an educational series for those of you with long COVID. I'm Dr. Tim Robinson, formerly a GP, family doctor for 30 years, and now working in Long Covid Services for 5 years. I post on all the usual podcast channels and also YouTube. If you like those postings, if you find them helpful, obviously click subscribe. I want to build up the followers in order to get the message out there to as many of you with long COVID as possible. Thanks also for all the feedback, the comments that you send in. I apologize in advance. I just don't have the time to reply to them, but please keep them coming because I do find them helpful because they guide me with future postings. The other thing I always start with is basically my usual disclaimer, and that is any advice or treatment that I mention in this podcast, other podcasts, should only be considered after you've discussed it with your own GP family doctor. So, this talk is all about palpitations. It is my update on palpitations in long COVID. I divided it into two parts. The first part is basically, what palpitations are, what our patients are telling us, and looking into their causes, their explanations about those long COVID palpitations. The second part, I will cover the treatments and strategies and how we go about helping those patients who are having long COVID palpitations. So there we go. Let's get into it. Let's get into part one. So what are our patients telling us? What are they experiencing? Well, what is a palpitation? And a palpitation is an awareness of your heartbeat, your pulsation in your chest. Patients describe it as a thumping, a thudding in the chest. They may feel those pulsations, those thuddings, also transmitted up into the neck. Those palpitations may be fast and regular. They may be irregular. They may last for a few seconds or a few minutes or even a few hours. They may be single thumps or they may be multiple thumps. Though, as I said, they may be multiple irregular thumps or regular thumps. They may be occurring at rest, more typically felt at rest, because when you're sort of up and about, moving around, they're disguised by, your activity, actions of the body, etc. So typically they are more frequently experienced whilst you're at rest. Particularly when you're sitting doing nothing, maybe watching TV or reading a book, or indeed that can happen at night. And I've had many patients who said that their palpitations often wake them at night. They may only be to do with your position. They may only occur when you're upright and walking around. Along with palpitations, those thumping, thudding sensations in the chest, you may also have additional symptoms. They come along with lightheadedness or a faint feeling. There may be a sort of clamminess, sweating. There may be shortness of breath. There may be chest discomfort, chest pain even. There may also be anxiety, worry, concerns, fears. And this is understandable, of course, because, if you're young and usually fit, etc., and all of a sudden you're starting having palpitations, and you'll become aware of your heartbeat, heart thumping, etc., this is out of the ordinary, and obviously we worry about things to do with the heart. So that can naturally lead to anxiety and fears. So what should you do? Well, with anything new, any new symptom, what do? You go to your doctor, don't you? You take the problem to the doctor, and quite rightly so. And the reason for this is that, obviously, to allay anxiety and get a diagnosis, but also we want to make sure we know what we're dealing with. But also, in the long COVID context, or because you've got this new symptom, it doesn't necessarily mean it's due to your long COVID. It may be something completely unrelated. So it's important to be able to distinguish between something that is long COVID from not long COVID. I talk about being COVID blind. You can be blinded by COVID, if you like, or because, as I say, you've got this new symptoms. Now that you've got long COVID, you could put it down to that. But let's not be COVID blind. Let's be sensible. Let's find out the diagnosis first. And the only way to do that is to consult your doctor. The doctor will ask you all about this new symptom, your palpitations. The doctor will then examine you. And the examination will include, obviously, cardiovascular system examination. So your pulse, your heart rate, your heart sounds, your blood pressure, both sitting, but also, hopefully, while standing. Then that leads often on to investigations. And as it's to do with the heart, no surprises, you're going to want to have an electrical tracing of your heart, an ECG done. And that will show us any heart strain, any signs of the heart struggling, not getting enough oxygen, ischemic changes we call it. But also it will show us the rhythm, and it then lead to various diagnoses. It may identify the actual reason for your palpitations. The GP then, if your palpitations are prolonged, but the GP may want to have a heart trace, a heart monitor put onto you for 24 hours, 3 days, 7 days, to get a long trace of your heartbeat and to look at how it changes through the day whilst you're doing activity, whilst you're at rest. And we call this the Holter tape. So it's a continuous readout of your heart rate. The GP may request a chest x-ray, again, thinking heart, looking for cardiac enlargement or signs of heart failure. Obviously, that's much rarer, but again, we've got to go through the motions of looking at all the various elements and investigate in the way we can. Blood tests, again, this is routine, standard, isn't it? And there are various conditions that can lead to palpitations, like anemia. So you're looking at the hemoglobin level. If that is low, iron deficiency anemia, that can lead to palpitations. Excessive thyroid activity, hyperthyroidism, thyrotoxicosis, classically presents with racing heart. Other symptoms like weight loss and sort of sweatiness, yes, and tremor, but elevated T4 level will make us diagnose thyrotoxicosis. That may be the cause of your palpitations. And finally, kidney function, blood tests looking at kidney function. So disturbance of your electrolyte balance can lead to palpitations. So all of those basic blood tests need to be done to aid us in the process of getting the diagnosis. All along, your doctor has been thinking to him or herself, looking for red flags. What are red flags? Red flags are those symptoms or signs which suggest other more serious symptoms. And, such as chest pain. That's a serious symptom. Is it because of not enough oxygen going to the heart muscle, so leading to angina, which can, as we know, lead on to a heart attack. So that's a red flag. Chest pain, central dull ache chest pain is a red flag. Unexplained fainting, again, that's another red flag. Unexplained shortness of breath, another red flag. So hand all those symptoms to your doctor. If the doctor has identified a red flag, the doctor will send you to the specialist, and quite rightly so. So that's what we should do when you have palpitations. Take them to your doctor. So then that leads us to the diagnoses. What are the diagnoses? The doctor's been through all the motions and has excluded other conditions and is left with palpitations. The doctor is then asking him or herself, well, what's the diagnosis? Well, it comes down to either the palpitations are irregular or regular. Okay, this is a way of because needless to say, there are lots of causes for palpitations, but this is a very handy way to distinguish between the different types or the different diagnoses that lead to palpitations. So irregular, let's cover the irregulars first. Okay, so those irregular palpitations can be just like single beats, sitting there and then suddenly thud, you feel something in your chest. You feel that was a heartbeat. Yes. Well, that's what we call an extrasystole. We all have them. Majority of us, the vast majority of us, don't realize that we have had every now and then an extra beat. In our, say, 70, 80 beats a minute, which is normal, okay, we might have had an extra beat, an extra systole. There's just, thumped in there, and then that's it. It's just sort of, if you like, suddenly a momentary, the heart gets out of kilter and squeezes an extra beat for whatever reason. This is innocent. Don't worry about this. Then there's irregular beats that are sort of persisting. Okay, so runs of irregular beats. It's sort of like, it's just like, I've heard it like a patient telling me it's like a frog jumping around in my chest, beating around. So no consistently, no regularity, just sort of here, there, and everywhere, but runs of these irregular beats. This is obviously a little bit more concerning, and this is suggestive of atrial fibrillation, which may well have been picked up on the ECG, the electrical tracing of the heart, but it does need treatment. We need to treat that because that can lead to stasis of blood, pooling of blood in the upper chambers of the heart, and leads to a blood clot, and then that can lead to a stroke. And so it needs to be treated. It needs to be brought under control. And also you need to be on a blood thinner for that. So that's an irregular, persisting, all over the place type of irregular beat of the heart, atrial fibrillation. Let's put all that to one side. Now then let's go on to basically regular beats. So there are two conditions in the long COVID realm which lead to runs of regular beats. Okay, the first is a condition called inappropriate sinus tachycardia, and the second is POTS. Let's talk about them both. First of all, inappropriate sinus tachycardia. So what's sinus tachycardia? Well, sinus tachycardia is the acceleration of your heart when you need to accelerate your heart. So say I get up and I want to go for and run to the door or go out for a run. My heart needs to increase in rate in order to bring about more energy production, more oxygen in order to basically bring about exertion and exercise. So that's tachycardia, and it comes from the sinus node, the node within the heart. Okay, sinus tachycardia. Sometimes, so that's normal sinus tachycardia, if you like, or appropriate sinus tachycardia, but in long COVID, you can have inappropriate sinus tachycardia, where the heart, for some reason, for no reason, for long COVID reason, goes into a rapid rate. And so patients, so I'm sitting, reading or watching TV or something, suddenly my heart goes into a rate of something like 120, 140 beats per minute when it should be like 70, 80 beats per minute. So it's inappropriately firing off at a rapid rate. Okay, so inappropriate sinus tachycardia. Long runs of regular heartbeats. The second diagnosis here in long COVID is POTS. What is POTS? POTS stands for postural orthostatic tachycardia syndrome. Okay, that is regular beats upon prolonged standing. Just pick the POTS apart. POTS, postural orthostatic tachycardia syndrome. Postural, posture, to do with the posture. Orthostatic, and that is a fancy Latin word to describe standing upright. Tachycardia, and that is rapid heart rate. Syndrome is a word to describe a collection of symptoms that suggest a condition. So, postural orthostatic tachycardia syndrome. So, regular heartbeats upon standing. Okay, not when you're sitting. So, when you stand and you basically are continuing to stand or walking around slowly, you can get this. But when you sit down, it settles. That's postural orthostatic tachycardia syndrome, POTS. So those are the diagnoses of palpitations in long COVID. So what are the causes of those palpitations? What leads to those palpitations in long COVID? Well, let's think back. COVID infection. The virus comes into the body and goes all around the body and causes what we know is inflammation. Inflammation around the body, around the circulation, around the systemic circulation. And inflammation, particularly of the blood vessels, of the circulation, the endothelial lining of the circulation. Along with that, you also have what's known as mast cell activation syndrome, MCAS. You need to listen to podcasts on that I deliver. I've got an update coming up as well. Mast cell activation. Microthrombi is another consequence of excessive inflammation in COVID. These mini blood clots that can go all around the body, particularly and also not excluding those minute blood vessels that serve the heart muscle. And then there are autoantibodies. So dysfunction of the autoimmune system leads to autoantibodies, antibodies attacking our own immune system. So these long COVID causes all result in a number of things. They can result in direct damage of heart muscle, and a damaged heart muscle doesn't beat normally. It can lead to damage to I talked about the sinus node, the node that controls the normal heart rate within the heart. Okay, so that node can be damaged, and that leads to palpitations. Long COVID, the COVID virus gets everywhere, doesn't it? Including the brain, and the inflammatory mediators can go up to the brain and affect the brainstem. What's in the brainstem? Basically, the cardiac center, the center that controls the normal heart rate. The coronary arteries can be damaged. So the coronary arteries are the arteries that serve the heart muscle, bring oxygen to the heart muscle. And if those are narrowed, then theoretically that can cause impairment of normal heart muscle function. And then, to add insult to injury, and part of what we know is happening in long COVID is dysautonomia, dysfunction of the autonomic nervous system. And that is the sympathetic nervous system is working excessively. And then excessive sympathetic nervous system, the fight and flight nervous system, can then lead to tachycardia, rapid heart rate, and that is felt in the chest as palpitations. Along with all that, obviously, if you're feeling the palpitations, I talked about, that sort of spooks people because, you can feel your heart, never feel my heart, I'm young and fit, da-da-da-da-da-da. That brings about anxiety, and then anxiety can bring on palpitations. So there are lots of causes for palpitations, lots of causes to explain why people have palpitations in long COVID. Like I said before, it's all proven. We've measured all these things. We can see them. We know all these processes are going on, which is really important for your validation. Yes, it is a reality. It can be demonstrated physiologically, measured, etc., etc. For those doubting Thomases, for those skeptics who say long COVID's all in the mind, no, it's not. No, it is not. All these things can happen. So anyone with palpitations can have all of those processes going on at the same time to some degree. So there we are. Like I said, it's really important to know those causes, because actually it validates and brings you peace of mind. And hence, actually, it's quite important for your own acceptance of your condition, because like I said, understanding brings peace of mind. So there we are. That's the first part of my talk on palpitations, this update on palpitations, what our patients are experiencing and the causes for those palpitations in long COVID. In part 2, I'll talk about how to tackle them. What we're going to do to actually sort of treat those palpitations, and the strategies to use in order to help control those palpitations. So there we go. I hope you found that helpful and clear, and hopefully see you in part 2. Cheerio.